Welcome to Rural Health Answers, a segment of our podcast, Rural Health Today, for you, our listeners, to ask questions only rural health experts can answer. Back with Alan Morgan, Chief Executive Officer of the National Rural Health Association. It's great to have you back here to answer a question from one of our listeners. And this is the question. If Medicaid is cut as proposed, where should rural hospitals even start with trying to preserve care for their community? How do they prepare to pivot their strategy if the worst was to happen?
Well, that's no easy question to answer by any means. And I got to tell you, just looking at the impact of Medicaid on hospital finances, for those of you that actually know them, you're going to look towards, are you utilizing your swing beds appropriately? You're going to look towards revenue cycle management. You're going to look towards partnerships with affiliated organizations. How can you network appropriately so? But there's no easy answer to that. And I mean, that's the reason why it's just so incredibly, incredibly important. With half of the nation's rural hospitals operating at a loss, cutting that off the table, there's no way to make up for it. You can come up with great strategies, but it can't be done.
Alan, there's no way to grow our way to that success. You can't have a growth strategy. Right. And unfortunately, we've often said in this industry, you can't cut your way to success either. Yeah. But when you lose $9 to $20 million from your budget, there is no other option on the table other than eliminating programs that historically cost the hospital money. And what are those programs? Sadly, obstetrics in rural communities, psychiatric care, other programs that are losses, home care, DME programs that support the community, and then the impact of that on the local community for community benefit, the opportunity for the respective hospital, who's usually the second or third largest employer in those communities, to lose your economic standpoint. Alan, there is so much at stake with this. It goes far beyond just the patient that has a Medicaid card not having access. It's far greater. It's about the economies of those communities. It's about the closure of those programs and or closure of those hospitals, which results in very bad care, poor healthcare outcomes for the communities. Communities are sicker. Economic development doesn't thrive when communities lose their primary healthcare. No one wants to relocate factories and businesses in communities that do not have hospitals or healthcare. And the downward spiral for any community is destruction. And that's on the good note.
Yeah.
Sadly. So thank you for joining us again. Thank you for answering the question. Hopefully we can avoid that question, right?
Absolutely.
Into the future.
Absolutely. Thank you.
Thanks for joining us. And thank you to our listeners for tuning in to this segment of Rural Health Today. Catch our next segment, Rural Health News, to stay up to date on the current state of rural health every Monday, wherever you get your podcast. Don't forget to check out the latest updates and resources from Rural Health Today at ruralhealthtoday.com. And make sure you've subscribed to the show so that you never miss an episode. Until next time, remember the power of rural.
Thank you for listening to another episode of Rural Health Today, the podcast where we connect you to what really matters in rural health. Rural Health Today is a production of Hillsdale Hospital in Hillsdale, Michigan, and a member of the Health Podcast Network. Our host is JJ Hodshire, our producer is Kirsten Newlon, and our audio engineer is Kenji Ulmer. Special thanks to our guests for sharing their expertise on the show, and also to the Hillsdale Hospital marketing team. If you want to submit a question for us to answer on the podcast or learn more about Rural Health Today, visit ruralhealthtoday.com.